Frostbite is when ice crystals form in a patient's tissue, and so that can affect nerves, blood vessels, or the tissue itself. Frostnip is a milder version of frostbite. In these cases, that can be treated at home, but in frostbite, that's a medical emergency, and you need to see a healthcare provider. Usually you'll see redness in the skin, and maybe the child will complain of tingling or numbness of the skin. And so if your child's outside, it's below 32 degrees, and especially in this area if it's windy, because if it's very windy, it can make it cooler faster. So if you notice your child has red skin and complaining of numbness, tingling, be concerned about frostnip, get your kid inside. Kids lose heat much faster than adults do. They evaporate heat at a greater rate than adults do because they have less fat tissue and their skin is more thin. And so kids' skin can lose heat quicker than adults, number one. And then the risk with kids is they're having fun outside. And as adults, we're cognizant about, oh, it's really cold outside, we need to come home, drink some hot cocoa. When kids are having fun, they're not as cognizant as adults, and so they want to stay outside no matter the risks and continue to having fun. Layer, layer, layer. Don't forget about cheeks, ears, fingers, and toes, and so make sure your child is appropriately dressed for the winter time. Totally okay to go outside and have fun, but limit the amount you are outside. And then if you notice these symptoms that we mentioned of frostnip, like redness of the skin, a child complaining of this numbness or tingling, have that child come inside and rewarm your child. So if you're worried that your child has frostnip, first bring your child indoors, change out their mittens or gloves into some dry clothing. In the affected area, take warm water, usually about 100 degrees Fahrenheit, and submerge the skin in that area until that child can feel sensation to the skin again. One point is don't rub or massage that skin. A lot of times parents will want to take a heating pad or a warm towel and rub that area. Try not to rub that area because that can cause or incite more tissue damage. And so change clothing into dry clothing, warm the area with water, and avoid rubbing that area. I like putting Vaseline after the fact. So when the kids come back indoors, okay to put Vaseline to kind of to protect that area and prevent damage from the cooling to heating that's going on. But I love Vaseline, and I think when they come indoors, lather your children up so their skin is protected.
The ideal thing is that you want to make sure that you're dressed in layers. You want to have a layer against your skin that's going to wick moisture away, that's going to remove moisture away, not only in your socks, but gloves, undershirts, long underwear, those sorts of things. You need to be conscious, again, layers to keep things warm. These days there are electric gloves, that little battery powered for gloves, for socks, for vests, things like that can be incredibly helpful. There are the chemical agents, the hot packs that people can use. You have to be thoughtful and careful with things like that because you can actually, areas that don't have a lot of sensation, you can cause a thermal or a heat injury to those areas as well. And we see that sometimes in people, for instance, who have diabetes, who have poor sensation to an extremity. They can put something that they think is helping and it can actually cause problems. So I'd say overall, the most important thing is you need to dress for the conditions and you need to be thoughtful. If you have the opportunity to spend part of the time doing the activity, whether that's watching a football game, whether that's ice fishing or whatever you're doing, if you have an opportunity to warm up for part of it and then go back out, that would be something that would also make it less likely that you're going to get a frostbite injury. But be very conscious of all of the areas that are exposed. As I said earlier, noses, ears, extremities, those are areas that are more commonly, can get a frostbite injury. if they're not covered, if they're not protected. If you think about it, the tip of your nose, your ears, the blood supply is going to be a little less robust to those areas. So if you're not paying attention, you're not wearing a hat, you're not wearing, in these really cold temperatures, sort of a ski mask, kind of face mask, those areas will get extremely cold and can freeze. The people that I think you really need to think about the most would be children, because children may not recognize, what they're feeling, how severe it is, or people may not honestly always be paying attention to them. The elderly, so anybody who's older, we know blood flow to extremities isn't as good. People who have what we would call comorbidities, so say, the individual who has diabetes, who has blood supply problems to areas, maybe they've been a long-term smoker and they've got blood supply problems to, especially, their extremities. That would be another group. So there's really a large, it's really just about everybody needs to be careful. And as somebody who has teenage boys, young men tend to be a group that don't always think as clearly when they're at things. They get very excited. And, we've seen people who they think it's maybe going to get them on TV taking their shirts off in the cold. So it's really, it's being conscious of what the risks are and being careful about doing everything you can to not suffer an injury. You have to have an extreme sense of urgency. So different tissues have different abilities to survive after having suffered a cold injury. Muscle, as an example, is extremely sensitive. So it's different if you just have, say, a finger versus if you have an arm or if you have a lower leg. If you don't treat those muscles, if you aren't able to get blood supply and get them warmed sufficiently quickly, within, generally it's going to be less than an hour before there's going to start to be a degree of long-term damage. If you look at somebody, and you can see if somebody, say you're looking at their face and you see their cheeks are developing white patches or the tip of their nose, you've got to tell them, because they may not notice it. So you need to sort of help them. We need to help each other.
We see that people at the extremes of age, meaning young children and very old adults, have higher risks of being susceptible to extremes of temperature. During periods of extreme cold, we do see increased number of patients having complications. People who have breathing problems are at increased risk from the cold. There's always an uptick in respiratory viruses during those cold stretches, in addition to the environmental exposures such as non-freezing cold injuries and frostbite. One way to think about frostbite is to think of it as something we call an ischemic injury. Ischemic means lack of blood flow. Tissues that have a lack of blood flow need that blood flow restored as quickly as possible. Anyone who's experiencing symptoms that are concerning for frostbite should seek medical attention immediately. When we think about cold injury, most of us have experienced the sensation where our fingers start to get maybe a little tingly from the cold. As that progresses, the hands or feet might start to experience severe pain, then loss of sensation, and then discoloration and wounds. When it gets to the point where you're starting to feel severe pain, that's a sign that you need to get your body back into a warm environment. If you notice changes in color or wounds to your hands, then you definitely need to go to an emergency department for evaluation.
So frostbite is when the tissues actually start to freeze, and you get freezing all the way down to the level of the cells. When this starts to happen, you get blood supply that's compromised getting to the tissues, particularly when we think about fingers and toes, your ears, your nose, those kind of places. Once that blood supply is compromised, those tissues can actually start to die. And so really you're at risk for frostbite anytime you've got inappropriate clothing or no clothing exposed in a very cold environment. Early on, you get what we call non-freezing cold injury, and that's that feeling you get when you start to get the tingling in your fingers or your nose, sometimes your toes. From there, it can progress on to actually having pain in those digits. Once people start to experience that pain, it's time to get out of the cold. It's time to start getting warmed up before that can progress on to frostbite. The colder it is, the higher the risk of frostbite. Also, the more moisture that's in the air, the higher the risk of frostbite, because when things are damp and they're cold, the risk of frostbite is increased. And then if that wind chill is really, really high, the worse the wind chill, the worse our risk of frostbite. Make sure that you've got good warm coverage on your head. You lose a lot of heat through your head. Warm coverage on your head, warm coverage on your core using multiple layers. Multiple layers are going to be better than one layer. When it comes to things like your hands and feet, you don't want anything that's going to constrict the blood flow. You want to keep plenty of blood flow there. And again, you want to use layers whenever possible. If it's really cold, mittens are going to be better than gloves, because the mittens keep your fingers together so that they can transmit the heat better. With your feet, you want to make sure that you've got multiple layers of socks on, warmers in your feet, in your shoes if possible, on your socks, not directly on your skin, but on your socks. And the same thing applies to the feet. We don't want footwear that's too tight to where it's going to actually constrict blood flow. The sooner you get treatment from frostbite, the better. So as soon as we recognize frostbite, the better. We're definitely going to have the best success within the first 24 hours, but ideally we want it to be as short as possible. Really, kind of time is tissue in this case, and so the sooner folks can get in and get treated, the better chance of them having a good outcome.
There's two components. One is just what cold weather does to your heart health. So as soon as you walk in, let's say you're about to go shovel snow, as soon as you walk into that driveway, your heart is already under stress before you've even picked up a shovel. So the cold weather causes your small blood vessels that are in your fingers and your toes and your skin to constrict, to narrow. And when they narrow, the overall pressure in your cardiovascular system goes up. And the heart is what sees that pressure. And so the heart is pumping against this high pressure. So now the heart is seeing this high pressure, so it has to increase its pressure. So your blood pressure goes up, your heart rate goes up. So before you've even done anything, your heart is already under a little bit of stress just standing out in the cold. The second component is, now let's say you take on an exertional activity like shoveling snow. So now your heart is under stress and you're putting further stress by doing something heavy like shoveling snow. And that's not surprising that if you combine those two things, you're asking for trouble, and why we see increased heart attacks in patients who end up doing these things. The people who are really at risk are people who have prior history of heart problems. So if you've had blocked arteries in the past, stents, or heart attacks in the past, or really high family history of heart attacks, those are the people that are most likely the highest risk of having heart issues with cold weather. Now, often it's not just the cold weather. It's usually cold weather that increases your risk, and then you doing something exertional, such as clearing snow off of a driveway. That usually the combination of those two things is what leads to the potential risk of heart attack. I think that's one of the main things that you can do to protect yourself, is be aware of the warning signs. So things to look out for would be chest, any sort of chest discomfort. So chest pressure, chest pain. It can present in a lot of different ways in different people. It can radiate to the neck, the shoulder. So just kind of in the chest area, be aware of any sort of discomfort that you're having that you haven't had before. You can start having profuse sweating, nausea, shortness of breath. So I would say those are probably the most common symptoms that we see. And so try to be aware of those. And if you don't ever have those, or that's out of your norm, if you have those, it's very important to seek immediate care, because timing of an intervention or diagnosing of what's going on is very important. You don't want to delay and wait and check out the next day. If you're concerned or having any of those symptoms, you should seek immediate care. It's actually very interesting. There's been several studies now. So two things have been clearly, the relationship of cold and heart has been clearly delineated. One, there's more heart attacks and strokes in the winter months. So we know that for sure. Number two, there's people that get hospitalized with heart attacks or die with heart attacks goes up when there's snowfall. So that actually has also been shown in studies. And it's not just with snowfall, but the amount of snowfall. So as the snowfall goes up, the rates of heart attacks, people who are dying from heart attacks and who are being hospitalized with heart attacks go up. And the duration of snowfall, so how many days there's snow, also leads to higher rates of heart attacks. And what we see in those studies is that the peak of those rates often happens the day after the snowstorm has subsided, and it often is in a majority of men. So, which is often leads us to think that this is likely due to people going out, shoveling snow the day after the snowstorm, which is leading to these increased rates of heart attacks. So it's quite literally, the risk is there. It has been shown clearly in the studies. And so this discussion that we're having, I think, is very, very important and quite literally can save lives. It's usually a late presentation. So they won't come in, they'll say, hey, I was shoveling snow and I got some chest discomfort. And then they went inside and thought it was nothing. And, their wife made them some coffee, and so they slept on it. And the next day it got worse and they finally come in. And now you're seeing kind of the damage done to the heart because they waited too long for the heart attack. So that's not uncommon for us to see. So I think, again, why this is so important for people to understand is that risk is real. The time sensitiveness of if this does happen is very important. So being aware of all of this can really, really, can save lives.